Hello, my name is Blaise Dubois. I'm a physiotherapist specializing in running injury prevention and treatment. Today, our short segment will focus on modifications that can be made to the running shoe with respect to different foot pathologies. First, we have Achilles tendinopathy that can be caused by friction from the heel notch. One of the procedures involves cutting a longitudinal incision in the heel notch to reduce friction on the Achilles tendon. There is also Haglund's syndrome, or Achilles insertional tendinopathy, also known as pump bump.
Souvent, on va appeler ça la bosse du coureur. Il y a une proéminence osseuse qui va venir faire friction.
Friction from the rigid heel cup can irritate this bony protrusion. One of the procedures we can do to protect this bump and reduce friction is to use a protective sock with integrated gel pads.
Chaussette qui s'accompagne d'une sorte de gel. C'est la première intervention que l'on peut faire. On peut aussi couper.
We can also use a donut-shaped foam cutout that we can place around the bony protrusion directly on the skin or inside the heel cup.
Système collant d'un côté pour appliquer directement sur la peau ou à l'intérieur de la chaussure. Donc on pourrait le mettre à l'intérieur de la chaussure pour aller décharger la zone de friction.
In more severe cases, we can make a small hole inside the shoe to reduce friction.
Dans la zone où on a la prééminence osseuse pour aller décharger cette région-là.
For fat pad syndrome, we'll improve the running shoe cushioning at the heel by inserting a gel heel lift.
En enlevant la semelle interne et en insérant à l'intérieur une sorte de gel que l'on mettrait en dessous de la semelle interne dans la chaussure. Une autre pathologie.
For plantar fasciopathy, with pain located along the arch and/or the heel, we can once again relieve the pain by cutting out the insole.
Enlever la semelle interne et encore une fois, décharger la zone problématique en faisant une incision.
Obviously, these modifications are for the short term only. Metatarsalgia is another pathology that affects runners. This pathology is characterized by pain in the metatarsal heads of the forefoot. We can use a metatarsal pad made out of foam and hypofix to create a metatarsal support just in front of the painful area. We can also cut out the pressure spot in the insole where the patient feels the most pain. For hallux valgus and metatarsophlangeal arthrosis, with a bony prominence that becomes symptomatic when it rubs on the shoe, we can make some incisions in the area where there is more friction to create more flexibility in the running shoe without creating too much damage to the running shoe.
À différents endroits pour essayer de donner de l'expansion au niveau de la chaussure sans trop, bien évidemment, la fragiliser.
Black nails usually happen when the patient wears shoes that don't fit properly. Either short shoes or long nails will cause repeated impacts and jam the toenails against the shoe. Improper lacing can cause the foot to slide and jam into the toe box, also causing black nails. For these patients, we suggest that they first try to lace their shoes properly by using a double knot to support the foot and prevent slippage.
Par la tension, supporter adéquatement le pied à l'intérieur de la chaussure et l'empêcher de glisser. Il y a tout un système aussi pour.
We'll also check the patient's shoe size and recommend that the patient keep his toenails short. Extensor tenosynovitis is often caused by lacing that's too tight and secondary irritation along the top of the foot. We'll teach proper lacing to reduce pressure along the top of the foot, for example, like using elasticized shoelaces.
Pour laisser la possibilité d'expandre le pied dans la dynamique de course. Il y a aussi la
The extensor retinaculum can be irritated by the constant rubbing by the tongue of the shoe. To prevent the rubbing on the retinaculum, we can cut out the rigid part of the tongue.
Pour aller décharger la friction appliquée à cet endroit-là.
All of the procedures that are done to the shoe and insole are usually short-term procedures. For example, with metatarsalgia, we'll replace the part of the insole that we'd cut out and remove the metatarsal padding once the patient is pain-free. We hope this short segment will help you with the follow-up of your running patients. If you need further information about running injury prevention and treatment, please don't hesitate to contact us at therunningclinic.ca.